Thanks for coming again to our free lecture series. I really appreciate just you coming out early Saturday morning. Horrible fog. Typical Seattle, I suppose, right? So today, again, we're going to be talking about preventing sports injuries with natural medicine. I'll be going through more through prevention. Treatment will be something we'll talk about, say, on shift or with a visit with myself or other physmed docs. So a little bit about myself. I'm a Bastyr grad. I'm also a second-year resident currently at Bastyr Center for Natural Health. So I'm here. I have my own shifts, and I also have my own physmed shift as well. I'm also the current supervising doctor for this Bastyr Sports Medicine Club, which I was part of as a student for quite some time. I'm also a clinical director at Dr. Masa's integrative clinic. So that's another thing. So I studied directly under Dr. Masataka Takakura. He's prominent in our field in the sense of he's a triply licensed doctor. He's a ND, DC, LAC. He's currently since left Bastyr to work for the Seattle Mariners. That's him right there at spring training. That's just him. He's been published a lot in Japanese magazines and journals and articles. So the next thing is kind of how we participate at sports medicine, at the Seattle Marathons, at the Bastyr Sports Medicine Club. We take our students there and we provide kind of stretching techniques, muscle energy stretching. We also look at acute injuries if there are any. One thing about the Seattle Marathon is they do have a first aid tent there, so a lot of the injuries are triaged to them, but a lot of the students kind of like going there to kind of practice their modalities. So if you are running the marathon this year, feel free to drop by our I guess it's not really a tent, it's like literally one side of a building or warehouse building, so it's kind of cool. We also have acupuncture down there. They join us in that endeavor as well. Another event that we participate in is the Emerald City Classic Volleyball Tournament, one of the largest volleyball tournaments in Seattle. And this is ranging from female volleyball players from about, I guess, 12 to 18. Our students here, we provide a little bit more acute care. There is no other first aid tent. We are the first aid. We triage most of the things, and if there are anything that's urgent, we call the doctor that's on staff, MD. But typically we provide acute care, sprains. We get shin splints. We have seen fractures. We've seen dislocations and other lacerations from running into bleachers and whatnot. So another fun event that takes place around June. So something to come by, and it usually takes place in UW in their track. So goals for today. I just wanted to make sure to ask you guys if there's anything particular. I know I've already made a presentation, but I want to know if I want to meet your concerns or your curiosities. And I was wondering if you had any curiosities today, or what you want to get out of this presentation.
Well, I do yoga, and
okay.
If I try to do it outside of the class, I end up hurting my lower back. So that's one problem. Another problem is I'm a fiddle player, and I play for hours at a time sometimes.
Okay.
My hand bothers me a lot.
Okay.
So I'm interested in trying to work on that.
No, absolutely. So it sounds like repetitive use syndromes going on with the fiddle, and as well as kind of like low back postural things, and that's something I'll be talking about today as well. So that's going to be good. And yourself?
Yeah, a couple things. Counteracting the fact that I sit at a desk hunched over a computer all day.
Common. Yeah, absolutely.
And I've had some knee issues, so I'd be interested to hear about anything knee related. I've been a runner for a long time.
Okay, so you're a runner. Okay.
Good. And yeah, just I guess sort of either things you can do on a regular basis to sort of, I think I'm interested in prevention, for preventative side of things, like building a regular practice to make yourself a little more bulletproof. Okay, great. I don't know about bulletproof, but getting towards there for sure. So yeah, those are great things. Those will be somewhat covered. I won't be treating particular symptoms, or not symptoms, but diseases per se, but we will be talking about a broad generality of things. So I'm just going to talk to you guys again. How do you think you guys prevent injuries? What do you guys think? What's the most basic way of doing things? Or
Warming up.
Warming up, okay. What else?
Having moving properly. So.
Moving properly, good. Okay, so body mechanics, sure. Anything else that you guys know of? You do yoga.
Proper recovery.
Recovery, so nutrition, good. So I think the easiest way It's really simple. Just don't exercise. Then you won't get injured, right? But I'm only kidding, of course. Now, the thing is, don't exercise without first understanding the capabilities of your body. So that's probably the most important thing that you can do for prevention is if you know you can't touch your toes, don't try to touch your toes and, I guess, hurt your back, or try to run long distances when you have asthma. Things like that. Kind of know your capabilities, know your limits, or try to work past them through natural means, of course. So that's what we'll be talking about today. So the human body, as you can see, this is just a pair of individuals doing some acrobatic yoga. And the human body is resilient and it's amazing creation. I mean, all that is made possible by kind of our musculoskeletal system. We have our skeleton that's not really effective without kind of the tendons and muscles that kind of hold it together. Otherwise, gravity is just going to take the bones and just drop it to the floor. So one piece of our body is, the structural integrity, which we'll also talk about. Whoa, too fast. So how do we determine the functional capabilities of our body? So that's one of the main things we're going to be going through today. Just kind of teaching you what to assess and how to assess. Not in full detail, but kind of just give you an idea. So some components. We have strength, flexibility, endurance, balance, structural integrity, like I mentioned earlier, and nutrition. Those are some of the bigger key points that doctors kind of like to look at, physical therapists. I guess you can say PTs and personal trainers as well. But the other big thing that really guides what we look at is medical diagnoses. So if you have a pre-existing condition, we like to work with that first to kind of accommodate your body to what you want to do, your goals. Do you want to run, but you have osteoarthritis? Do you want to go rock climbing, but you have arthritis in your hands? There's things that we can do, and if you like running a marathon even, it's like if you have asthma, it's going to be a little difficult without first kind of managing your condition. So medical diagnosis is really big, but all this kind of meshes in together. So strength. We have Popeye here and Wimpy. So we're not talking really about the ability to bend steel. We're talking about the strength of your muscles. Are they capable to withstand rigorous activity? Are they able to withstand the pressures that you are going through while you work, while you sit in a chair all day, while you do yoga? Or are your muscles kind of flaccid or weak, decompensated due to other muscles being more developed? So this is kind of the strength piece, kind of working with the balance of musculature. And thank you for coming. We're kind of in the middle of our talk. Do you have any particular concerns today about, like, any curiosities that you might be interested in?
Just how to strengthen. I think strengthen.
Strengthen?
This is about injury sport.
Yeah, in a sense. It doesn't have to be sport. It could be just, yeah.
Exercise and stuff.
Yeah. So I think I'll hit on some of that, and we're just talking a little bit about it right now. So we will have some time for questions later too, so that'll work. So again, strength, just talking about the overall strength of your muscles or composition of your system. So that's one of the components that we like to look at on physical exams or when assessing an individual. Flexibility, we have Jean-Claude Van Damme, notorious for his ability to perform the splits. Flexibility is another big piece. Yoga is great, but it can also be detrimental if you do it incorrectly or if there's something that you're not doing properly. So flexibility is important. A lot of the, I guess you can say the participants at the volleyball tournament, but they have chronic ankle sprains. They go through injuries all the time. So flexibility doesn't just mean, oh, Dr. Kwan can't touch his toes, but it also means, this individual, this female, has gone through multiple ankle sprains, which is causing laxity, which can further compromise her strength, balance, and ability to do other kinds of tasks daily and through the day. So yeah, flexibility, that's another thing we assess. Again, not just the ability to touch your toes or do the splits, but also how lax your tendons are, musculature, and things like that. Another thing is endurance. So we would all love to run the marathon. So, I mean, that would be great, just be able to run every day, be able to go up a hill. I can't think of one off the top of my head right now. Fremont Ave. Oh yeah, oh, that one's brutal. If you're going to campus, that 65th Street or Juanita Drive, that is brutal as well. So are you a runner? Or are you a person who likes to stand in line at Dick's waiting for your hamburger? I mean, endurance is important too. That is your livelihood or of running or performing activities, how long you can perform. Again, this goes into what kind of medical condition you have. So if you're deconditioned because you have congestive heart failure, you're not going to be able to do a lot of things an individual can do if they're 25 years old and on a football team. It's going to be a little different. So all these things kind of fit together, again, to make, I guess, to help kind of bring us to an individual's goals. Balance. So balance, again, is not expecting you to have to kind of walk on a tightrope, but really balance is kind of our neurological assessment. Balance kind of, I wouldn't say, but generally speaking, as you get older, your ability to maintain balance is kind of compromised due to decompensation of muscles, tendons, bones, losing, I guess, having osteoporosis. Things as such can alter your balance. And balance is important because it gets us through our day in walking, hand-eye coordination, ability to pass, I guess you can say, the driving exams when a cop pulls you over. I mean, it's important. But I wouldn't suggest doing that, by the way. So yes, balance. Mm-hmm. Yeah.
So balance, just like calcium over age 30, people start losing it. So when is the balance kind of pivot point? Like after 50, 60?
So you mean when we should start focusing on it?
No, when we start losing the balance if we don't train for balance.
So if you don't train for balance, that I don't have any great values. There's no set, because everyone's different, definitely, and everyone's nervous system is kind of comprised differently as well, and it's based off history, and we'd have to figure it out, and there could be genetic disorders that can cause balance deficits as well, especially in the brain as well. So, so there is no set point, like osteoporosis or, yeah.
Okay, so there's like a healthy individual,
No, because say you're a football player, and I get multiple concussions. That's going to severely compromise their balance because they lose the ability to kind of adhere to their space. Healthy individual? And healthy individuals should have pretty good balance considering they do exercises every day and live a pretty good lifestyle. Their balance should be intact for a pretty long time. However, it depends on what an individual does. So if you maintain it, it can stay pretty strong. As for structural integrity, we have a house of cards right here. Structural integrity is what keeps our body together. I'm going to go ahead and just kind of prove a point real quick. So I just want to have you guys just kind of don't move, just kind of hang tight. Don't move a muscle right now. I'm just going to walk by, kind of just look at your posture. So what I'm seeing right now, even in our cameraman over there, is kind of anterior head tilt. Yeah. Common desk worker here. So what I'm seeing, looking at you guys right now, is kind of a slouch back and anterior head. So that's very common. If you look at the evolution of human posture, obviously this is very scientific, we're kind of progressing to a generation where we're moving kind of into always looking down, stressed out, gotta meet deadlines on a computer, or looking at our iPhones going, oh, gotta answer every one of these texts, make sure I'm checking my Facebook every second. This is our generation right now. It's just literally doing this all day. And that's not good. And I'm gonna show you why it's not good maintaining this posture. So these are common postural deficits. We can have sway back, lumbar lordosis, or kind of like that, kind of the big butt syndrome, they would call it. thoracic kyphosis. So kind of as you get older, you kind of do this, and also younger individuals who kind of at the desk all the time or look at their iPhone all the time. We have forward head is another thing that kind of fits in with this. And then this is kind of good posture where your ears are over your shoulders and everything's back, your shoulders back. That's good posture, but our kind of society is trending towards this sway back, lumbar lordosis. We sit in our cars a lot too, where we kind of sit in a kind of bucket seat that kind of causes our back to kind of lose this curve, so we can get a kyphosis of our lumbar vertebrae. So that's just a general look at things. The whole desk work, looking at iPhone syndrome, is called the upper cross syndrome. What that basically entails is weak neck flexors, and then weak, I guess you can say, rhomboids, kind of the muscles in between your scapula, tight pecs, so kind of like this inverted hand thing. If you look in the mirror and you notice your hands are like this, you look like a gorilla, that's kind of a tight pec syndrome and a weak rhomboid. We also have tight upper traps, so that whole thing when your shoulders are up and you're just like, oh, I'm so mad. No one's responded to my status on Facebook. It's like, oh, that's what this is. So this is very common posture, and we like to tend to work to prevent this. It's important because if you have good posture, the spine or the cervical spine is supporting about 10 pounds of pressure on that spine. However, as your neck leans forward more and more, the neck is having to support more and more weight due to the position of the spine. So it's moving from 32 to 42 pounds when it's really, really anteriorly displaced. We also have low back values here. So at standing, the pressure on the lower back is about 100%. Lying down, it decreases. Lying on your side, it kind of goes up a little bit, but at 100%, this is when you're standing. However, when you're bending over kind of like this, you're increasing it to 150%. Picking up a dumbbell or something, a box, you're increasing to 220 pounds right there. And then if you're sitting at a desk, bad posture, and you're doing that again, you're increasing it to 275% of pressure from the original standing position. This is important because what happens when you pick things up like this? What happens?
Strain.
You can get strains. Yeah, absolutely. You can herniate a disc. There's a lot of things that can happen, especially if you're rotating and like picking things up like this. That's not good. So we want to, at Bastyr, we like to kind of educate our patients and trying to use good body mechanics, to use our legs when lifting boxes or getting on the ground, lifting and only moving towards and within our line of vision. So that's good posture and body mechanics. So if our cameraman needs to pick up his backpack today, it's like this. Just letting you know. All right. Nutrition. This is another important thing. So you were talking about nutrition. We do like to focus on that. So Harvard School of Public Health, they created a healthy eating plate. That's a little different than what you've normally seen. If I go back, what's typically on our healthy plate by the USDA?
Like the food pyramid?
Yeah, food pyramid. What's typically on there? Grain, like bunch, right? There's like a huge pyramid. It's like 11 servings. What else is on there? Meat. Yes, you got your meat, protein, you got some veggies, some fruits. Yeah, definitely. You got fats and oils. Like it can be butter, it could be candy, it could be whatever they wanted. The Harvard plate is a little different. They make some changes. So they give you kind of proportions. So they say some fruit, mostly vegetables and protein. So we're talking dark leafy greens, we're talking lean meats, chicken, lean poultry meats, fish. Those are really good types of healthy protein. Red meats can be a little bit more inflammatory because of the iron content. The higher the iron content, the more inflammation is incurred on the body. Pork has histamine production or produces histamine in our body, so that can be inflammatory as well. So aiming towards more of a vegetable protein, lean poultry meat, really clean, really good for the body. Whole grains, we're not talking We're not talking whole bagels. We're not talking cinnamon toast crunch. We're talking whole grains. We're talking quinoa. We're talking buckwheat, amaranth. We're also talking just wholesome wheats, steel-cut oats, things like that that kind of help promote kind of good fiber intake and carbohydrate kind of release into our body. The only difference also is that they add water. Water is important. We should be having about 5 to 8 glasses a day of water, just staying hydrated. We're typically drinking Starbucks. Tea, fantastic. I'm drinking coffee. I didn't have coffee today, but tea is fantastic. But our society, especially Seattle, we drink too much coffee. So how many cups of water should you be replacing with, or how many cups of water should you be drinking if you're drinking 1 cup of water? Coffee, sorry. Do you guys know?
2.
About 2 cups of water. Yeah, it's kind of silly, but it's not, because the coffee is actually a kind of a mild diuretic. You're losing water as you're drinking coffee. So something to consider. Healthy oils. We're not talking butter. We're not talking, again, those things that are vegetable oils that aren't just like your normal average vegetable oil, but we're talking canola oil, coconut oil. We're talking monounsaturated fats like, I guess coconut, but also avocados, things like that. We're trying to promote healthy oils. So those are things that we can manage at our shifts here at Bastyr, and we like to focus on this. This kind of diet is a little bit more anti-inflammatory, especially with the things that we do in our lives, very pro-inflammatory. So we want to decrease that. So yeah, just a consideration. Nutrition's big. Mm-hmm.
Coconut oil is considered healthy.
Yeah, coconut oil is good. Yeah, absolutely. Yeah. Medical conditions. So again, this is just a simple list or a simple pictorial view of medical conditions, but we're talking diabetes, we're talking acute injuries like whiplash, we're talking asthma, we're talking heart, cardiovascular disease. These are things that we need to work with the patient in order to create a kind of custom-made exercise program or some sort of program to help with their goals. Do they need to lose weight? Do they want to run more? Do they want to be able to go up the hill or go up the stairs because that's where they work? They don't want to take the elevator anymore, or they had a stint where they don't want to be in a wheelchair anymore. There's things that we can do to help kind of ease the, I guess, make things easier for patients or to allow them to have a more better or improved quality of life. And so that's what we're focusing on here with this slide. We don't just go haphazardly into treating a patient like, all right, you have congestive heart failure, you have diabetes, you can't feel your feet, all right, let's go run a mile. No, we can't do that. We have to tell them to take it slow. We have to tell them to start walking slowly, meeting guidelines with general, just kind of slowly getting there, kind of doing 30-minute walks daily until they kind of get into good habit, get rid of the paresthesia in their feet through our natural treatments to see if we can get that treated, have them get their blood sugars to a nominal level, help their heart kind of treat with healthy foods, healthy supplements, things to consider again, and trying to help balance out their medication toxicity, decrease that load on their, or burden on their liver. So just some pieces there. Do you guys know who this guy is?
Shakespeare?
Not Shakespeare. It does look like Shakespeare. I guess it's close, but this is Francis Bacon. He's the I guess you can say the father of the scientific method. Well, he's coined in saying knowledge is power. And so that is kind of, in a sense, prevention. Knowing what your body is capable of doing empowers you to make sure that you don't do what will cause you to continue to injure it, to further exacerbate your arthritis or your osteoarthritis. It's just things that we kind of help try to show our patients here at Bastyr. We like to talk to our patients and kind of empower them, educate them. That's really big. So why should we care? Why should we care about preventing? Why should I care about my knees? I mean, they hurt, but can I just keep running on it? You know, just things like that. Should I keep doing yoga even though my back hurts? We'll talk about that right now. So here are some typical acute early injuries that some people typically kind of ignore or can ignore. So sprains, strains, like the young individuals playing volleyball, they just say, oh gosh, sprain, all right, when can I go back out to play? I was like, oh, whoa, you have to calm down there. But a lot of these girls kind of keep going out and playing, getting more sprains. We've got joint dysfunction. So if we're talking kind of overuse of the knee, and we're talking osteoarthritis, it's kind of things that kind of goes in that point. So overuse symptoms, fiddle playing. So there's things that you can do to help decrease the inflammation when you do a lot of kind of continuous, similar, I guess, pattern type activities. Muscle spasms, trigger points, congenital conditions. Can't really help you here, but there could be educational pieces that can be, I guess, provided for the patient. Fractures, broken bones, if they don't heal correctly, can cause issues in the future. So what if you don't listen? Oh, that's the wrong picture. What if you don't listen to your body? What could potentially happen? What do you guys think if you continue to run your knee?
You just make things worse.
Can make things worse? What else?
Damaged tissue.
Damaged tissue, yeah. So you can further cause inflammation. Tendons in the area can kind of start kind of breaking down, and you can get tendinitis, you can get bursitis, you can get ruptures of the tendon because they're just so damaged. You can get bone-on-bone contact, absolutely. So those are the acute things. But what happens in the chronic phase is you can get arthritis, calcifications of muscles, ligaments, bone spurs. You've all heard of those things. Complex regional pain syndrome. So if things don't heal correctly, nerves don't heal correctly, you can get these complex regional pain syndromes that are really hard to treat because they're hard to find their exact branch of the nerve that's causing it. Fibromyalgia is another one of those, I guess, like a conglomerate thing of symptoms. But fibromyalgia is getting big, and it's not something to kind of be ignored. Because they've been saying that there are some psycho-emotional components to fibromyalgia. There are definitely contributions to whatever activities that we've done in the past. It can also be medical treatments, chemotherapy. It could be anything that caused trauma to our bodies, which doesn't allow it to kind of heal correctly, or heals in a really awkward manner so that the nerves don't fire correctly, or there's blockages. Or if you're into AOM, the meridians could be kind of blocked off there too. So again, and permanent postural misalignment. Let's see. So this is just a quick rundown of basic common areas of pain that our patients come in with: back pain, headaches, whiplash, osteoarthritis, carpal tunnel syndrome, and what we have up here is kind of rotator cuff tears. A lot of these things can be prevented. If you look at all these, I mean, everything here has something in common. If you have whiplash, there's a lot of damage to the SCM, or sternocleidomastoid, in addition to kind of bone-on-bone, I guess, pain as well, due to the severity of whiplash. You can have facet joint capsulitis when the joints kind of encroach on each other during an accident. Tears, if you don't treat them, can progress to full thickness tears, and you have to get surgery to fix that. So again, all these things here can be prevented or preventable, and we tend to try to do a lot of those things naturally here at Bastyr.
You were talking about
Facet joint capsulitis.
Okay, what is that?
It's just, so our joints, facets, yeah. It's kind of our joints in our neck, yeah, and they kind of just sit on top of each other like this, and they allow us to kind of rotate our head, and it's kind of like the joints here in our fingers, kind of these joints right here, but they're kind of in our neck.
So like it's not...
It's kind of like this. It's positioned like this. Our spine's kind of situated like that. Really hard to see here, but we can, I'll show you some pictures later. Yeah, absolutely. So conventional treatments, pharmaceuticals, the hospital, or let's just say it's surgery. So there's a lot of really toxic things here, but sometimes they do help. I mean, there is that point when natural supplements don't work, or don't work work as quickly as we need them to. There are things that we can do to help decrease pain. Muscle relaxants for those who have kind of herniated discs. When a disc herniates in your lumbar spine, your muscles tense up to protect that area so that it doesn't get damaged. So muscle relaxants are often prescribed by MDs. I spent some time with a doc during my rotation here at Virginia Mason. He's a fantastic doc, love him. But I mean, this is all they have. It's just, okay, well, you got pain, muscle relaxants. Muscle relaxants not working? Here's some opioids. I mean, it just makes me kind of sad seeing that we aren't coupled up with them and working with them. We have so many things we can do. We can do manipulation. We can do natural anti-inflammatories. We can do contrast or hydrotherapy to these things. There's just such a broad area of treatments that we can do rather than just muscle relaxants. If that muscle relaxant doesn't work, let's use another muscle relaxant. Oh, that one doesn't work? Let's put some steroids in there. So it's very common for them to kind of use these kind of similar approaches, and it doesn't really change much. And they don't have anything else for the patient except for physical therapy. It's like, oh, these didn't work, I'm going to give you to my physical therapist and have you work with them. So, I mean, that's kind of how things are right now. There are some good docs. I'm not talking bad. It's just the limits of their medicine versus the possibilities of ours. So again, we have opioids, which can also cause addiction and dependency. Steroids. We have nerve blocks. We have electrical stimulation. We have surgery for decompression. So if you have if you have stenosis of your spine, they literally take pieces of your spine off and leave it open so that the spine isn't so inflamed. I mean, that's just craziness. Excision and sectioning, so splicing of nerves or removing of discs is just like so invasive when we can try to prevent these naturally and try to prevent getting to having to use these things. We also have other implants, so we got screws, rods, plates. I mean, these are things like, especially if your whiplash isn't treated and you constantly are sitting at a desk, I mean, you can get to the point where the bones are kind of necrosing and they can't support each other anymore. The discs are so flat and dehydrated that they're literally sitting bone on each other. You would generally need to get kind of plates or rods to kind of support your neck again. And it's an unfortunate circumstance.
Still talking about the
yeah.
If it's kick sound, what does that, is that
the clicking sounds, that could be many things. But typically, generally speaking, it's normal. It's normal. After whiplash? If there's history, it could be many things. It could be laxity of the joints. It could be the tendons rubbing against each other on the, yeah. It could be very tight or it could be very loose. So it could be either things, yeah. So yeah, it could be hypermobile or it could be very, very hypertonic.
So it's not just one.
No, you can't just say it's one thing.
I'm kind of curious, if it's loose, how could that make him sound though? I'm kind of curious. You say it's loose.
If it's loose, yeah, it could be very mobile and can be causing kind of like the joints to constantly pop. You can do that. And if your muscles are weak because they're kind of injured and they're inflamed, it can definitely cause that. Yeah, I mean, but of course we'd have to take a physical exam. It's just kind of generally what I've seen. A lot of people are like, oh, I do this and it clicks. But we have a lot of ligaments in our neck and our spine that kind of rub against each other once in a while. So it's pretty common. I hear it a lot. I'm not going to say that there isn't anything wrong or so. Absolutely. Yeah. So how can naturopathic medicine help? This is where we kind of get into kind of an understanding of naturopathic medicine. Here's a big definition of naturopathic medicine provided by the American Association of Naturopathic Physicians. What this boils down to is basically naturopathic medicine is treating the patient holistically. We're looking at the patient as a whole, utilizing kind of the most up-to-date scientific journals and evidence. We also like to kind of promote kind of the natural healing of the body through kind of natural means of just kind of whatever Mother Nature kind of intended us to do with our bodies. It's just, and yeah, that's just breaking it down. Naturopathic medicine is basically promoting health through education and all these things. And so I'm going to go into our principles. So we promote kind of the healing power of nature. We also try to identify the cause and treat it. We don't just treat symptoms. So our MD colleagues tend to treat symptoms. They find kind of, so that's, you may have heard it kind of called sick care, but really they treat symptoms. And so if you have, I guess you can say, just kind of pain radiating down your leg due to some disc herniation, they treat the symptom. They take the steroid and inject it into whichever lumbar root is kind of, or nerve root is affected, and that's it. They might send you to PT, but sometimes they don't. Again, Virginia Mason does a really fantastic job as a doc, PT working together. They treat it, and then they get them into kind of a retraining, how to reposition and how to, I guess you can say, postural exercises to kind of strengthen muscles. So they do that. It's getting more and more common now because you can't just, the people are noticing that you just can't treat symptoms. First, do no harm. So that's very important. We don't want to, there's no ego here in naturopathic medicine. We don't want to harm our patient because we've heard that, or this particular medication works or supplement works, but might cause harm to you, but I know it works. We're not in that game. We want to try to treat the patient as non-invasively as possible before we're moving on to kind of referrals into more invasive techniques. Doctor as teacher is probably the most important, is the one that I cherish and kind of respect the most, and why I kind of like the residency program currently right now. I've TA'd a lot and taught a lot of students, but I think that's most effective is when we teach our patients. When we teach our patients to understand what's going on, the processes of their diagnoses, or how to do a particular exercise, or why they're doing a particular exercise, that's very important. And then again, treating the whole person as a whole and prevention. These are just the key aspects or principles of naturopathic medicine if you guys didn't already know. Any questions there about the naturopathic principles? So we also abide by what's called a therapeutic order. Again, what I was alluding to earlier about kind of working from the least invasive to most invasive. So that's what we like to kind of trend towards. So we like to remove obstacles to cure. So say an individual comes in with fatigue and some back pain. So what's causing them to not heal could be potentially their inability to not getting poor sleep. They're not taking care of themselves. They're not sleeping early enough. They're not eating. Maybe they're constantly are sitting at their desk all day and not getting up to stretch. So we want to remove these obstacles, or is there a kind of psycho-emotional state that we need to treat as well? We'd like to kind of look at that. We like to stimulate the vis. Does anyone know what a vis is? Life force. Yeah, very good. Vis. So we like to stimulate the natural life force, or our body's capability of healing. We also like to strengthen the weakened system. So if we have adrenals that are shot, we like to treat that first before moving on to any other thing like hormone replacement therapy. We kind of like to treat in that sense. Correct structural integrity, use natural substances. We also use pharmaceuticals if necessary, so antibiotics. If a patient is 104, has a 104 temperature, and not getting better, they're toxic, they're not starting to lose the ability to breathe, and they're kind of going to shock, antibiotics kind of has a place. There's a time and place for everything. The beauty of conventional medicine and naturopathic medicine is that they're fine by themselves, but together they kind of create an amazing medicine that should be shared with everybody, and not just having just one conventional care or one natural care. And then after that, we can refer for more higher force kind of interventions, I guess you can say. So cancer is something that we don't treat legally in Washington, so we like to work with medical oncologists, and as long as we have a medical oncologist on board, we can help treat symptoms of potential chemo or radiation symptoms or side effects, kind of help them with their diet. So patients with cancer typically have a lot of side effects, poor nutrition, or their nutritional status is compromised because of cancer. So we like to kind of work in that way, preventing the progression of the disease. So what kind of tools do we have as naturopaths? Well, we like to work first and foremost with lifestyle and dietary modification. Counseling is also in there as well. Nutraceuticals, botanical medicine, homeopathy. We also follow conventional standards of care. So that's really important in keeping the patient safe. So again, with patients with diabetes or kidney failure, we like to look at lab values and kind of work with patients to make sure everything's safe, and also talk with their primary care physicians as well. And we also have physical medicine, which is the basis of today's talk. So some studies on natural anti-inflammatories. We have a product called Mariva, and it's a curcumin, and it's been phosphatidylcholine has been attached to it to make it more absorbable in the gut. They did a study on 100 patients, 100 test subjects, let's just say, 50 in a group with Mariva, and 50 in a group with just nothing, placebo. They did that, and they found in the research that the Mariva significantly decreased or increased or improved their clinical and biomechanical outcomes. So what that means is they had these test scores, or these little tests, and they marked it down. So their pain was probably really high in the beginning, and then after taking the Mariva, their pain was kind of minimal or reduced. They used less NSAIDs. They used less medications, opioids. They had less flare-ups. They also had less, what was the other thing? They had less visits to the doctor. So this is very cool. This is research done by Belcaro et al. If you guys want this article, let me know. I can provide this for you. Very fascinating read. So getting to the physmed department, this is where, as second-year residents, we have a shift. My shift is on Thursday nights. So physical medicine department. What do we provide there? We provide all these things. So when a conventional doc has muscle relaxants, opioids, and steroids, we have all these things to help. So these are just some of the things we have. We have naturopathic manipulation. We have therapeutic ultrasound. Do you guys know what ultrasound is? Yeah?
Got it done for my ankle.
Nice. So therapeutic ultrasound isn't the diagnostic ultrasound where you look for babies, I guess you can say. Therapeutic ultrasound is utilizing sound waves to kind of stimulate cells and things in the localized area to kind of make things, kind of induce heat, induce things, cells to vibrate, break down adhesions. That's the theory, at least. And as we see here, our cameraman has had his ankle treated with ultrasound, and has it been pretty good?
Oh yeah, it was awesome.
Yeah, what happened to your ankle?
I had a really acute injury about probably 7 weeks ago or so, completely rolled in and popped the ankle and tore tendons, ligaments.
Right.
And they did cold laser, ultrasound, and then a lot of acupuncture as well. So
Okay.
kind of quickly.
Getting strength back, everything.
Oh, yeah.
Okay,
Yeah.
fantastic. And so so cold laser, he just mentioned a cold laser. Do you guys know anything about lasers besides Star Trek and all that stuff?
Is it relative new things in therapy now, the laser, or it has been
It's been around for a while now, yeah. There's many classes of laser. We have a cold one, so it's non-thermal. It's just kind of light photons focused into...
using light.
Yeah, just using lights. Basically light therapy, yeah.
What would you use cold laser therapy?
So-
He was
Mhm.
use it for the acute.
So it sounds like their treatment protocols was kind of aimed towards decreasing inflammation, breaking down adhesions from, I guess, reducing scar tissue, and also to decrease pain. So the ultrasound helps decrease scar tissue, or theoretically does, and also to decrease pain by inducing heat in the localized area. The cold laser, it sends out photons. So photons are light, I guess, photons, ions, I don't even know what we call them. But photons are sent out, and they activate photoreceptors on our cells to kind of increase metabolism in the localized area. So this kind of induces healing, essentially. Yeah.
In physical medicine, because I also heard that in the regular, in East Coast, the physical therapy, they say, oh, we use laser. So is it, when they are in the physical therapy wrong, right, they use cold? Or is it just in this clinic use cold?
This one we use cold.
Also, they also have used
They have heat. They do have thermal lasers as well. I know the Seattle Mariners. I don't know if that's top secret or not, but they use thermal lasers. So one's going to be a lot hotter, and one's going to induce heat. You can actually probably feel the thermal lasers that the Seattle Mariners use. Ours, you can't feel anything. It's literally, yeah. It's more intracellular and kind of extracellular as well, I guess, and on that level. So.
Would that be deeper than ultrasound?
It could potentially be deeper because photons are a lot smaller and they can penetrate clothing, they can penetrate thick tissue as well. That's the thought at least, because they're so small. But yeah, we typically treat localized areas, and that's definitely something we can do. We also do this craniofacial. It's supposed to say craniosacral therapy. Have you guys heard of craniosacral therapy? So that's a fantastic, low force, very energetic, balancing modality that we offer here at our clinic. We have a lot of supervisors that do teach that. Dr. Massa was one. We have Dr. Courtney Cusack here. We have Dr. Bosted. A lot of people are trending towards craniosacral therapy. It's just a level of kind of human touch that doesn't get addressed elsewhere. So craniosacral therapy, I can't speak much, any less about it. It's amazing. It's something that I still need to learn. So definitely, we're always learning, but something that's very important, very awesome. Visceral manipulation is also within that realm, kind of energetic treatment of our viscera or our organ systems or our tissue or kind of restrictions in our joints. This is a really great technique that's offered at Bastyr. We also have focused deep tissue, soft tissue manipulation, therapeutic exercise, SOT blocking, kinesio taping, lymphatic drainage, muscle energy stretching, hydrotherapy. We have constitutional, far infrared sauna, contrast hydrotherapy. All these things, definitely feel free to ask me after that just to talk more about it. But these are just some of the things that we offer. Yeah. SOT is sacro-occipital technique. So sacrum and then sacral and then occiput. So these are this area. In the past, Dr. Desjarnette utilized this technique to help treat his patients. I think he used that and he coined that. Really fantastic technique. The blocking itself really helps with kind of our pelvic region, but it has an overall encompassing effect on the overall body as well because of how it treats. It's like manipulation. Yeah, it's like manipulation. What was that? Yeah, it's something like that, and a lot of chiropractors do practice this technique. Naturopathic manipulation is essentially chiropractic technique. We're taught by chiropractors, so we're all really good at that stuff. We're not all, I'd say some of us are. So definitely ask your healthcare professional if they know how to do it. So and this is just a refresher of kind of what we talked about earlier, the functional capabilities of our body. So again, we put this all together to kind of create a treatment plan for a patient. So something on naturopathic manipulation, or chiropractic. So this has also been researched to be more effective than sham. So they kind of pretended to do a manip or something. They pretended, so there's a sham, there's also muscle relaxant and chiropractic. They did a study on 192 patients, and after the research, they found that pain was significantly reduced as well, and definitely more beneficial than placebo and muscle relaxants. So in that sense, what that makes me think is we're saving money. We're not buying excess medications. We're seeing a chiropractor to treat whatever ailments we have, our low back pain, and doing whatever else that aren't, as naturopaths, we kind of change your nutrition as well and work on your exercises. If we get you to a point where you can take care of yourself, there's no need for essentially doctors except for maintenance work. If you're taking care of yourself, you don't have to go to the doctor as much. You save money. And I know it's not a good business model for naturopaths, but that's what we believe in. We don't want to keep seeing the patient and just say, all right, come back in 2 days and we'll just do the same manip again over and over and over again. No, we want you to kind of come in, get your maintenance, do the exercises, do the treatment plan that we mentioned, and then just keep doing that until like, oh, I really can't do this on my own today. I need your support. I mean, that's what we are. We're basically your support in I guess your fight against your body and maintaining that. So yeah, so a little research on naturopathic or on chiropractic. If you want this research article, I can provide this to you as well. Kinesio Tape is another thing that we offer. Dr. Masa was really big on this tape. Have you guys heard of Kinesio Tape? Have you seen it? The Olympics had it. But basically, Kinesio Tape is fantastic for lymphatic drainage. So what you're seeing here is someone that pulled or tore their hamstring right here. So they treated it with what we call fan taping. It's a kind of technique where we kind of create these little squid-looking patterns, and we place it over the affected area and draw it towards our lymphatic draining points. So through a course of treatment, you're noticing, what are you noticing when you're looking at this individual's hamstring? Yeah. The hematoma that you're seeing, the bruise, has been significantly decreased in the areas where the tape has been applied to. So you're noticing kind of a pattern where the tape was. So this is just some really light touch techniques. Kinesio Tape is a therapeutic elastic tape that is really, really gentle, and it's really facilitating kind of the skin reaction, kind of its connection with our muscles and with our brain. So the brain kind of knows, it stimulates the brain receptors to kind of tell the body to do something. That's the general rundown of what the theory is.
So when you have this type of treatment using tape, they cannot do it for very long.
No, this is...
They cannot tape on
they,
years.
So. You probably could, but it's just, it might not be good for the skin, and it's really temporary, very, very temporary, and only really used to treat and help support. So if an individual has lymphedema, do you guys know what lymphedema is? So lymphedema is when, generally speaking, if say you have your lymph nodes removed, your lymph nodes are compromised, there's no more drainage within that area of the body's going to start building up swelling. So Kinesio Tape has been really effective in treating that. We've done one with a patient of mine that had lymphedema, chronic lymphedema from a sentinel lymph node removal. She had breast cancer. So after that, they had poor pre-op and post-op follow-up with her. So her arms started getting really swollen. Our treatment was focused on doing Kinesio Tape to her antecubital fossa, into her axilla, and across her chest to kind of really stimulate. Actually, I take that back. We didn't really focus on the axilla because that's where the lymph nodes were removed. So we drew from the back, so from her scapula to the other side. There are a lot of draining points. What we noticed with the treatment with our manual therapies, we also did that. We did ultrasound. She also had Dupuytren's contractures as well, so she had these nodules in her hands that we were treating with kind of manual therapy and ultrasound. What she noticed was that her swelling didn't get any larger. It kind of stayed normal. At times it would change, but generally it didn't allow it to progress. So we're able to kind of keep the swelling at bay, or lymphedema at bay. And it's really up to her, and she just really needs to do a lot of at-home things. She came to our visits, and she had a daughter that did a little manual therapy as well for her. And just that combination was really effective in kind of keeping it at a plateau and not getting any worse. But definitely, it becomes taxing when she went traveling, or when she went to California to visit her daughter. She noticed that her arm got increasingly large because she didn't do the therapies that we did for her, no Kinesio Tape. So eventually we empowered her by teaching her how to Kinesio Tape herself. Brought her daughter in to tape for her and learn how to do it so that could be more sustainable for them. So definitely things that we love to do here at Bastyr. So a little quote I want to leave with you guys, or impart with you guys today, is a little Chinese proverb that I've always kind of stuck around, not because I'm Chinese, but because it just means a whole lot. So this quote says, "Tell me and I will forget. Show me and I may remember. but involve me and I will understand. And so this quote, I mean, this essentially wraps up naturopathic medicine into just kind of one little quote. And we kind of like to involve our patients in their treatment plans and whatever it is. If they don't understand why they're doing ultrasound or why they're taking curcumin or why they're doing that, it's not going to be as effective as saying curcumin is anti-inflammatory, it's going to help your osteoarthritis, there's a lot of inflammation in your joint. Curcumin has been shown to decrease that inflammation so that it allows that knee joint to heal. So we're going to do all these, so that sounds different than, here, take this supplement, I'll see you in 2 weeks. We like to show them, tell them, whatever it has to be, and it's all about education here. So thank you guys for coming. I have time for questions now if you guys just kind of ask questions if you guys want.